You may have heard the term functional medicine and wondered exactly what that means and how it's different than regular medicine. Let me explain this to you today. I'm Dr. Greg Celaya. The best analogy to explain functional medicine is this. If your engine light comes on in your car, do you just place a piece of black tape over it so you can't see it anymore? Or do you actually lift the hood to see what's causing the problem? Functional medicine tries to find the root cause of a health disorder rather than masking symptoms with drugs or surgery. Although medication and surgery should not be avoided when needed. Because everything in the body works together, seeing a functional medicine doctor for a gut problem, for example, can also improve your brain function and hormone issues. Suppose 10 different people have the same complaint such as fatigue. Each of those 10 people can have the same symptom, but for 10 very different reasons. For instance, fatigue in one person could be due to low blood sugar, while in another person it may be due to an autoimmune disease or B12 anemia. Until you know why you're suffering from a health issue, chasing drugs or therapies can keep you landing at dead ends. Functional medicine is based on published, peer-reviewed science to help us understand where breakdowns can occur in the body. In my office, I use lab tests, questionnaires, exams, and a case history to help me find the underlying root cause. In functional medicine, we usually start with some very common root causes, starting with food intolerance, especially gluten and dairy. Next is either low or high blood sugar. Another common cause is bacterial and yeast overgrowth in the intestines. And sometimes the immune system attacks and destroys body tissues, which is called autoimmunity. Functional medicine looks at the body as a complex web where all the systems relate to each other instead of just looking at certain body parts or specialties. For example, if the gallbladder is acting up, addressing a gluten intolerance or chronic inflammation can sometimes prevent surgery. If your thyroid is sluggish or overactive, it's important to check for autoimmunity, and the list goes on. Thanks for tuning in. I hope you've learned some things about your health. If you'd like to know more, please go to my website, drcelaya.com, where you can schedule for a free 15-minute consultation or become a new patient. We'll look into your issues with lab work to get to the root cause of your problems. If you'd like to see more videos about your health, please subscribe below.